If you are over 60 and your hands or feet often feel cold, even when the room is comfortable, do not brush it off as just getting older. Sometimes cold fingers and toes are harmless, but sometimes they are your body's quiet way of saying that blood, nerves, warmth or energy are not reaching the outer parts of your body as well as they should. In the next few minutes, you will learn 6 simple clues that can help you understand what cold hands and feet may say about your circulation, what you can safely do at home, and when it is time to call a doctor. Stay with me until the end, because one warning sign means you should not wait for your next appointment. Maybe this happens at night. You pull the blanket higher, put on socks, and still your feet feel like little blocks of ice. Or you hold a warm cup, but your fingertips stay cold and stiff. You may wonder, is this normal at my age? You are not alone in asking that question. Many older adults notice that they feel colder in their hands and feet than they used to. But the important question is not only whether you feel cold, it is when it happens, whether both sides feel the same, what your skin looks like, and what other changes come with it. You're watching this channel, where we explain simple, healthy aging habits in plain English. If this kind of calm, practical health information helps you, please like this video, subscribe, and leave a comment with your age range or the symptom you notice most. Now let's make this clear from the start. Cold hands and feet do not automatically mean you have a serious circulation problem. The body normally sends more warm blood to important organs when you are cold, stressed, tired, or sitting still for a long time. Your fingers and toes are at the far ends of the road, so they can feel the change first. But after 60, it is worth paying closer attention because cold hands or feet can sometimes appear along with conditions that affect blood flow, nerves, blood sugar, thyroid function, blood count, or the way your body controls temperature. Think of your circulation like a home delivery system. Your heart is the main pump, your blood vessels are the roads. Your blood carries warmth and oxygen, and your muscles, especially the calves, help move blood back upward when you walk. If traffic slows, a road narrows, or the pump needs more support, the farthest rooms in the house may feel the change first. That does not tell you exactly what the problem is, but it gives you a reason to notice the pattern. The first clue is whether the cold feeling is equal on both sides. If both hands or both feet feel mildly cold on a chilly day and warm up when you move around or add a layer, that can be a normal response. But if one foot is clearly colder than the other, or one hand changes color while the other looks normal, take that seriously. One-sided change can sometimes point to a blood flow issue on that side, especially if it comes with pain, numbness, weakness, or a color change. Do not try to diagnose yourself by touching your own pulse or comparing temperatures once. Instead, notice the pattern over several days. Is the same foot always colder? Does it happen at rest, while walking, or only at night? Does it improve when you move? These details can help your doctor much more than simply saying, "My feet are cold." The second clue is what happens when you walk. This part matters because narrowed leg arteries can sometimes cause a very specific pattern. You may feel aching, heaviness, tightness, or cramping in a calf, thigh, buttock, or foot after walking a certain distance. Then the discomfort eases after you stop and rest. People often assume it is only arthritis, weak legs, or getting older. It may be one of those things, but it can also be a sign that working muscles are not getting as much blood flow as they need during activity. The medical name for this pattern is claudication. You do not need to remember that word, just remember the pattern. Discomfort with walking, relief with rest, and the same thing happening again when you walk a similar distance. Here is the important part. Not everyone with a circulation problem feels the classic cramp. Some people simply slow down more often. Some say their legs feel tired sooner than they used to. Some blame their shoes. Others avoid stairs without realizing why. So do not wait for a dramatic pain before you mention it. If your walking distance has become shorter, your feet feel cold, or one leg feels weaker or more tired than the other, bring it up at your next medical visit. Stay with me, because the next clue is something many seniors overlook in the bathroom or while getting dressed. The third clue is a change you can see. Look at your feet in good light, especially after you take off your socks. Is one foot paler, bluish, or darker than usual? Is the skin unusually shiny or smooth? Have you noticed less hair on the lower legs? Are toenails growing more slowly, becoming thick, or changing in a way that is new for you? None of these signs proves poor circulation on its own. Skin changes can have many causes, but when several changes appear together with coldness, numbness, walking pain, or slow healing sores, they are worth discussing with a doctor. This is also why foot checks are so valuable after 60. You do not need to become worried or check every hour. A simple look once a day, perhaps when you put on socks or before bed, is enough for many people. Look between the toes, at the heels, and around the sides of the feet. Notice cuts, blisters, cracked skin, redness, swelling, or a sore that is not improving. If you have diabetes, regular foot checks are especially important because diabetes can affect nerves and blood vessels, and a small injury may be easier to miss. Do not use a sharp tool to trim thick skin or attempt home treatment for a deep sore. Protect the area and seek professional advice. The fourth clue is numbness, burning, tingling, or a strange pins and needles feeling. This is where circulation and nerves can get confused. A foot can feel cold even when it is not very cold to the touch. That can happen when nerves are sending mixed signals. Nerve changes are more common with diabetes, vitamin problems, some medicines, alcohol use, and other health conditions. On the other hand, a foot that is truly cold to the touch, especially compared with the other foot, deserves more attention for blood flow concerns. You do not have to solve the difference yourself. Your job is simply to notice whether the feeling is inside the foot, on the skin, or both. Try this simple, safe observation. When your feet feel cold, place the back of your hand on each foot, one at a time. Do they feel about the same? Then gently wiggle your toes and stand up slowly if you are able. Take a short, steady walk around the room with support nearby. If the cold feeling fades after gentle movement, that is useful information. If one foot stays much colder, turns pale or blue, or becomes painful, do not force exercise to push through it. Stop and seek medical advice. The fifth clue is your daily routine. Long hours of sitting can make the legs feel heavy, stiff, and cold. When you sit still, your calf muscles are not doing their usual helper job. Many people call the calves a second heart because each step and ankle movement helps squeeze blood back up from the legs. This does not mean walking cures circulation disease. It does not. But gentle movement can support normal blood flow and reduce the stiffness that comes from being in one position too long. A simple rule can help. Every hour that you are awake, change position. Stand up carefully, take a few steps if it is safe, or do 10 slow ankle pumps while seated. Point your toes away from you, then pull them back toward you. Keep the movement easy, do not bounce, do not hold your breath. If you use a walker, cane, or chair for support, use it. The goal is not a workout. The goal is to remind your lower legs that they are part of your day. You can also try a gentle evening routine. Sit in a stable chair with both feet on the floor. First, take 5 slow breaths. Then lift your heels while keeping your toes down and lower them slowly 10 times. Next, lift your toes while keeping your heels down and lower them slowly 10 times. Then circle each ankle slowly 5 times in each direction. Finally, stand only if it is safe for you, hold a sturdy counter or chair, and take a calm 1-minute walk around your home. If you feel pain, dizziness, chest pressure, unusual shortness of breath, or weakness, stop. This routine is not a test of toughness. It is simply a gentle way to reduce long periods of stillness. There is one more everyday pattern to notice: cold feet that appear mainly in bed. Sometimes this is simply because the body cools down during sleep, the bedroom is cooler, or you have been still for hours. Some people also tuck blankets so tightly around the feet that the toes cannot move comfortably. Try a lighter layer over the feet, loose, warm socks, and a little ankle movement before you get into bed. Keep the room comfortably warm, not overheated. If you wake with feet that are cold but otherwise normal in color and sensation, and they warm gradually with gentle movement and clothing, write that down. But if nighttime coldness comes with foot pain at rest, color change, numbness, or a wound, do not assume it is a sleep problem. For hands, notice whether coldness appears when you grip a steering wheel, hold a phone, work in a cold kitchen, or sit with your arms crossed for a long time. Gentle finger opening and closing, relaxed shoulder rolls, and warm gloves outdoors may help with comfort. Avoid smoking, including just one cigarette, because nicotine can tighten blood vessels. And be careful with very tight watches, bracelets, or sleeves that leave deep marks. Comfort matters, but the bigger goal is to notice whether your hands return to their usual color and feeling after you warm up and move around. Before you try any warming trick, you need to know this. The sixth clue is how your cold hands and feet respond to heat. Warm socks, gloves, a blanket, and a comfortably warm room are usually reasonable ways to protect yourself from the cold. But do not put numb feet directly on a heating pad, hot water bottle, space heater, or very hot bath. When sensation is reduced, it is easier to get burned without realizing it. This is especially important for people with diabetes or nerve problems. Warm slowly and gently. Choose soft socks that are not tight around the ankles. Avoid anything that leaves deep marks, pinches the toes, or cuts into the skin. Some people also notice fingers changing from pale to blue or red when they are cold or stressed, then becoming tingly or painful as they warm up. This can happen with a condition in which small blood vessels tighten too much in response to cold. It is often called Raynaud's phenomenon. It is not something you should diagnose from a video, but if these color changes are new after age 60, severe, painful, or happening only on one side, contact a doctor. It is worth checking rather than simply treating it with thicker gloves. Now let's talk about the health factors that can quietly sit behind cold hands and feet. Smoking or tobacco use can damage blood vessels and make circulation problems worse. High blood pressure, high cholesterol, and diabetes can also affect blood vessels over time. These are not reasons to panic. They are reasons to know your numbers and keep regular appointments. If you have been putting off a blood pressure check, blood sugar test, cholesterol test, or medication review, cold feet can be a useful reminder to get back on track. Never stop a prescribed medicine because your hands or feet feel cold. Some medicines can affect how cold you feel, but any change should be discussed with the doctor or pharmacist who knows your full history. Feeling cold all over, not just in the hands and feet, can also happen with problems outside the circulation system. Low thyroid activity, anemia, not eating enough, dehydration, infection, or certain medicines may play a role. That is another reason not to jump straight to one answer. Your body is more like a team than a single switch. Blood vessels, nerves, muscles, hormones, food, sleep, and medicines all work together. A doctor may use your symptoms, an exam, blood tests, and sometimes a simple comparison of blood pressure in your ankles and arms to look for causes. You do not need to request a specific test. Just give clear details about what you notice. Here is a practical 7-day check-in that can help you prepare for that conversation. For the next week, make a small note once a day. Write down whether your hands or feet felt cold, whether it was both sides or one side, what you were doing at the time, and whether you had pain, numbness, color changes, swelling, or cramps while walking. Also note whether gentle movement helped. Keep it simple. A few words are enough. Tuesday night, both feet cold, better after socks and ankle movement, or Thursday morning, right foot colder, calf cramp after walking. This is not for self-diagnosis. It is a clear record that can help a clinician see a pattern. While you are doing this, give your feet some basic protection. Wear well-fitting shoes with a wide toe area. Do not walk barefoot, especially if you have numbness or diabetes. Check inside shoes for small objects or rough seams before putting them on. Keep skin clean and dry, and use moisturizer on dry skin, but not between the toes, where trapped moisture can irritate the skin. If you cannot safely see the bottoms of your feet, use a mirror on the floor, or ask a family member, caregiver, or podiatrist for help. Small habits matter because prevention is easier than treating a wound that has become serious. Let's be clear about what not to do. Do not ignore a sore because it doesn't hurt. Numbness can reduce pain even when skin is damaged. Do not massage a painful, swollen calf if the swelling is new and one-sided. Do not wear tight compression socks unless a clinician has told you they are suitable for you, especially if you may have an artery problem. Compression can help some people with vein-related swelling, but it is not right for every cause of leg symptoms. And do not make big changes to exercise if you have new pain, severe breathlessness, dizziness, or a history of heart or circulation disease without checking with your healthcare team. The next part may be the most important part of this entire video. Cold hands and feet are often not an emergency, but certain combinations are urgent. Seek emergency care right away if a hand, foot, or leg suddenly becomes very cold, pale, blue, numb, weak, or severely painful, especially if it is different from the other side. Also, seek urgent help for sudden one-sided leg swelling with pain or warmth, especially if you also have chest pain, trouble breathing, coughing blood, fainting, or a racing heartbeat. Call emergency services for chest pressure, sudden shortness of breath, a drooping face, trouble speaking, sudden confusion, or weakness on one side of the body. These symptoms need fast medical care, not home remedies. You should also contact a doctor soon if you have a foot or leg sore that is not healing, pain in the foot while resting, repeated cramps with walking, a new color change, worsening numbness or coldness that keeps returning without a clear reason. You are not being dramatic by making that call. You are giving yourself the chance to find the cause early, when there may be more options to protect your mobility and comfort. So what can cold hands and feet after 60 say about your circulation? They can simply mean you are cold, still, stressed, or in need of another layer. But when coldness is persistent, one-sided, painful, or linked with walking cramps, numbness, color changes, weak pulses, slow healing sores, or changes in your ability to walk, it may be a sign that your body needs a closer look. Notice the pattern. Move gently and regularly. Protect your feet. Keep your blood pressure, blood sugar, and cholesterol care on schedule. And speak up early instead of assuming every change is part of aging. For tonight, keep it easy. Check your feet in good light. Put on comfortable socks. Do a few slow ankle movements from a chair. Take a brief, safe walk inside your home if you are able. And write down anything unusual, especially if one side is different from the other. These small steps cannot diagnose or treat a circulation condition, but they can help you notice changes and explain them clearly to your doctor. Tell us in the comments, do your hands and feet feel cold mostly at night, after sitting or while walking? And are you in your 60s, 70s or 80s? Subscribe for more simple, caring health guidance for older adults. In the next video, we will talk about another everyday body signal that many seniors mistake for normal aging.